Okay, hi, this is the second part of the reading and exercises of chats from 10 to 13. Okay, the chapter 10 is primary care. A, the National Health Service. The National Health Service, NHS, is responsible for health care for everyone in the UK, although a small number choose to pay for private care. Treatment is free but there is a prescription charge for drugs and appliances, such as a cervical collar, with exceptions for some patients, such as children and the elderly. Primary care is provided by general practitioners or GPs, sometimes known as family doctors, also by nurses, dentists, pharmacists, and opticians. GPs work in practices of 1 to 10. Practices are based in a surgery and look after the health of from 1,000 to 15,000 people in their local community. They also provide health education in areas such as smoking and diet. Run clinics, give vaccinations, for example, for influenza, and may perform minor surgery, such as removal of warts and moles. If a patient needs specialist care, the GP will make a referral. That means refer the patient to a consultant in secondary care. Patients are normally seen on an appointment basis. Some visits are made when patients are housebound, unable to leave their homes, or too ill to attend surgery. Out of hours treatment from 6 p.m. to 8 a.m. is provided by the local primary care trust, which organizes shifts of GPs and locums GPs to cover if someone is absent. Note, the noun surgery has 3 meanings. The building where GPs work, for example, the practice has moved to a new surgery on the high street. A time when GPs see patients, for example, morning surgery is from 8:30 to 12:30. And the work of surgeons. The patient needs urgent surgery on a burst appendix. Ok, atención primaria. A, el Servicio Nacional de Salud. El Servicio Nacional de Salud es responsable por el cuidado de la salud de todo el mundo en el Reino Unido, aunque un pequeño número decide pagar por cuidado privado. El tratamiento es gratis, pero hay un cargo de prescripción para medicamentos y dispositivos o aparatos como cuello cervical. Pero hay algunas excepciones a algunos pacientes como niños y envejecientes. La atención primaria es proporcionada por médicos generales, a veces conocidos como doctores de familia, también por enfermeros, dentistas, farmacéuticos, y ópticos. Los doctores generales trabajan en prácticas, grupos de 1 a 20. Esas prácticas o grupos están basadas en consultas y ellos cuidan la salud de desde 1,000 a 15,000 personas en su comunidad local. Ellos también proveen educación de salud en áreas como fumar y la dieta, inyectan o dan vacunas, por ejemplo la de la influenza, y también pueden llevar a cabo pequeñas cirugías como remover verrugas o lunares. Si un paciente necesita cuidado especial, el médico hará un referimiento, es decir, referir al paciente a un especialista en atención secundaria. Los pacientes normalmente son vistos con citas o en citas. Visitas en las casas son realizadas cuando los pacientes son convalecientes o esto es cuando los pacientes no pueden salir de sus casas o están muy enfermos para atenderse en una consulta. Fuera de horas, el tratamiento fuera de horas es de 6 de la tarde a 8 de la mañana y es proporcionado por el Centro Local de Atención Primaria, que organiza turnos para los médicos y sustitutos de los médicos para cubrir si alguien se ausenta. Nota, en el sustantivo cirugía, surgery, tiene tres significados. El edificio donde los doctores trabajan, por ejemplo, la práctica fue movida a un nuevo edificio en High Street. El horario en el que los doctores ven a los pacientes, por ejemplo, la consulta de la mañana es de 8:30 a 2:30. Y el trabajo de los cirujanos, que sería la cirugía. Por ejemplo, el paciente necesita cirugía urgente para un apéndice explotado. B, the practice team. A typical GP practice employs receptionists. They are responsible for initial patient contact, making appointments, taking requests for repeat prescriptions, taking messages from patients and other healthcare providers, and for filling and scanning documents into patient records. The practice manager has responsibility for finance and sometimes for it. Supervises reception staff, hires locums, and helps prepare the practice development plan. Practice nurses run asthma, diabetes, and cardiovascular disease clinics, as well as one-to-one clinics for those who wish to give up smoking. In addition to practice staff, GPs work with a number of health professionals. District nurses visit temporarily housebound patients, such as recently discharged hospital patients, to change dressings, such as ulcer dressings. Health visitors to visit families to carry out checkups on young children, particularly under 5s, to make sure they are healthy. Special attention is paid to families in need, such as those living in poverty. They also do baby immunizations. And midwives run clinics for antenatal patients. And physiotherapists provide hands-on treatment, but also teach patients exercises they can do to improve their condition after an accident or operation. A GP's day. Dr. Stewart works in a practice in a small market town with 3 other family doctors. The surgery is in the center of the town and is shared by 3 practices. This is a typical working morning when she is not the duty doctor, responsible for emergencies and urgent problems. Okay, this is, and at 8 a.m., arrive at the surgery, check the out-of-hour email print out, check for urgent and not urgent messages, check in, okay, from 8:30 a.m. At 8:30 a.m., check emails from the health board and partners, and prepare for surgery. 8:30 to 10:50 a.m. is morning surgery, 10-minute appointments, and 6 pre-booked last week, 2 booked for 48 hours ahead, and 4 of them bookable on the day. From 10:50 to 10:15 a.m., check with reception for messages, sign prescriptions, and deal with repeat prescription. And at 11, from 11 a.m. to 11:20 a.m. is coffee break in the conference room with colleagues. And from 11:20 to 11:30 a.m., check home visits, requests, and divide up visits. And at 11:30 a.m. to 1 p.m. are the home visits. Entonces, B, el grupo de práctica. Un médico típico eh, que practica emplea recepcionistas. Esas son responsables del contacto inicial con los pacientes, realizar citas, eh, tomar en cuenta pedidos de prescripciones repetidas, en tomar o leer mensajes de pacientes y otros proveedores de atención de la salud y de llenar y escanear documentos en el récord de los pacientes. El Practice Manager tiene responsabilidad de las finanzas, de supervisar el personal de recepción, contratar suplentes y ayuda a preparar el plan de la práctica a desarrollarse. En Practice Nurses llevan a cabo clínicas, charlas para diabetes, asma y enfermedades cardiovasculares, como también eh, uno por una charlas para aquellos que quieren dejar de fumar. En adición o además del personal de práctica, los doctores trabajan con un número de profesionales de la salud, como vimos en la unidad 8. En enfermeras distritales del distrito visitan temporalmente a los pacientes en sus casas, como aquellos que han sido dados de alta recientemente del hospital para cambiarles la ropa o cambiarles en los apósitos para úlceras. Los visitantes de la salud visitan familias para llevar a cabo chequeos en niños pequeños, particularmente aquellos por debajo de 5 años, para asegurarse de que estén saludables. Una atención especial es prestada a las familias necesitadas, como aquellos que viven en la pobreza, y ellos también hacen inmunizaciones a los bebés. Las parteras llevan a cabo todo relacionado a los bebés, como el embarazo y el parto. Y los fisioterapeutas proveen tratamiento con las manos, pero también enseñan a los pacientes ejercicios que ellos pueden hacer para mejorar su condición después de un accidente o una operación. La C, día de un médico general, Dr. Stewart, trabaja en una práctica o en una ciudad, en un mercado en un mercado pequeño de la ciudad con otros 3 doctores. El edificio es en el centro de la ciudad y es compartida por otros 3 practicantes o doctores. Eso es un día típico de trabajo de la mañana, cuando ella no es la encargada del servicio o responsable de las emergencias y problemas urgentes. A las 8 de la mañana llega a la consulta o al edificio, chequea emails, chequea mensajes urgentes y no urgentes y chequea correos de compañeros que se están preparando para cirugía. De 8:30 a 10:50 son las consultas de la mañana, son a citas de 10 minutos cada una, 6 de ellas reservadas la semana pasada, 2 con 48 horas de antelación y 4 reservadas en ese día. De 10:50 a 10:55 am, ella chequea con recepción chequear si había algún mensaje, también para firmar prescripciones y lidiar con prescripciones repetidas. De 11 a 11 y 20 es un descanso para tomar café en la sala de conferencias con los colegas. De 11 y 20 a 11 y 30 AM, chequear pedidos que tienen para las visitas a las casas, y de 11 y media a 1 son las visitas a la casa. Okay, here are the exercise of this. Okay. Okay. Number 10. Okay, I'm going to continue reading. Okay, continue. Okay, here are the exercise of this chapter. 10.1. Complete the sentences. Look at a opposite to help you. Children over 60, over 60s, and people with some chronic disease do not have to pay prescription charge in the UK. Patients with mobility problems may be unable to go out. They are housebound. The average GP appointment is 10 minutes long. A locum is someone who takes the place of a staff member who is on leave. Care outside working hours is known as out-of-hours treatment. 10.2. Make word combinations using a word or phrase from each box. Change dressings. Make appointments and make home visits. Perform minor surgery. Refer a patient. Run a clinic. Supervise staff. And take messages. 10.3. Which member of a practice team would be responsible for each of the following? Look at the opposite to help you. Number 1, running a clinic for pregnant women, midwife. Teaching a patient how to strengthen his broken leg, physiotherapist. Letting the GP know that a patient can come to her appointment, that's a receptionist. Running a clinic for people who want to for people who want to lose weight, that's a practice nurse. Visiting a patient who has just returned home after a hernia operation, district nurse. Carrying out checkups on children in a poor neighborhood, health visitor. And organizing cover for an absent doctor, practice manager. 10.4. Complete the diary for Dr. Stewart's afternoon. Look at A and C opposite to help you. And from 1 to 2 p.m., practice. Okay. Practice teen meeting over sandwich lunch. From 2 to 4 p.m., afternoon surgery. And 12 10-minute appointments. From 4 to 4:20 p.m., coffee break. From 4:20 to 5 p.m., check with reception for messages, deal with home visits, and repeat prescription requests. From 5 p.m. to 6 p.m., paperwork, for example, referrals to secondary care, and admin tasks, telephone calls to patients, and private medical examinations. And at 6 p.m., phones switched to out-of-hours service. Okay. Chapter 11, Medical Education 1. Medical education in the UK and covers undergraduate education, 4 or 5 years at medical school, the section of a university responsible for medical education. A 2-year foundation program which provides training for new doctors after graduation through a series of placements in different specialties. Postgraduate training, which doctors take to become GPs or consultants, senior specialists, often delivered through colleges for different specialties. For example, the Royal College of Physicians. Continuing professional development in the form of courses and seminars, which doctors undertake throughout their working lives to keep up to date. B. Extract from an undergraduate prospectus. The Bachelor of Medicine and Bachelor of Surgery is a 5-year undergraduate medical degree course. Most of your learning takes place in small groups. The main components are core, years 1 to 3, and an integrated program of clinical and scientific topics, mainly presented through problem-based learning, PBL, where you work with others on a series of case problems, vocational studies, and clinical skills. This component prepares you for the clinical skills required for contact with patients from year 1 of your course through periods of practical training where you are attached to a hospital department or general practice. Student-selected models allow you to choose from a menu of subjects such as sports, medicine, or even study a language as preparation for an overseas elective. A hospital attachment of your own choice between years 4 and 5. And clinical attachments from year 4 to 5 and 5. A series of 4-week clinical attachments in medicine, surgery, psychological medicine, child health, obstetrics and gynecology, and general practice. C. A student's view. Ellen, a medical student, describes her course. I'm just finishing my first year of medicine. What I like about this course is that you are involved with patients from the very beginning. Even in our first year, we spend time in hospital. Much of the course is problem-based learning. We have 2 2-hour sessions a week where we work in groups of 8 to 10 solving clinical problems. We decide together how to tackle the problem, look up books and online sources, make notes, and discuss the case together. It's a great way of learning and getting to know the other students. In the past, medical students had lectures with the whole class, taking notes from lectures from 9 to 5, but now it's mainly group work. Also, we do have some lectures and seminars where we work in small groups with a tutor. I like all of it, even the dissection. We get to cut up cadavers, and from the second month of the course. Ok. Educación médica 1. Educación médica en el Reino Unido cubre lo siguiente. La educación antes de graduarse o no graduado, 4 o 5 años en la escuela de medicina. En esta sección, de esta sección es responsable la universidad de la educación médica. En 2 años de Foundation Program, que provee entrenamiento para aquellos doctores luego de graduarse a través de una serie de puestos en diferentes especialidades. Después de graduarse, ese entrenamiento donde los doctores se convierten en doctores generales o especialistas. Normalmente llevados por colegios a diferentes especialidades, por ejemplo, el Colegio Real de Médicos. Y continuando con el desarrollo profesional en la forma de cursos y seminarios donde los doctores, toman, llevan a cabo en su espacio de trabajo para mantenerse al día. En extracto de un prospecto antes de graduarse. Licenciatura en medicina, licenciatura en cirugía o título es título, un título de curso de 5 años antes de graduarse. La mayor parte de tu aprendizaje toma lugar o se lleva a cabo en pequeños grupos. Los principales componentes son del año 1 al tercero, es un programa integrado de temas científicos y clínicos, mayormente presentados a través de aprendizaje basado en problemas, donde tú trabajas con otros en una serie de casos de problemas. Estudios vocacionales y habilidades clínicas. Este componente te prepara para las habilidades clínicas requeridas para el contacto con los pacientes desde el primer año de tu curso, a través de periodos o entrenamiento de prácticas donde estarás familiarizado a un departamento hospitalario o práctica general. En módulo de estudiante selectivo. Te permiten elegir de un menú de materias como medicina del deporte o incluso estudiar un lenguaje como preparación para un intercambio en el exterior, un acercamiento al hospital de tu propia elección y durante los años 4 y 5. Y desarrollos clínicos, encuentros clínicos del año 4 al 5, es una serie de 4 semanas de acercamientos clínicos en medicina, cirugía, medicina psicológica, salud, salud de los niños, obstetricia y ginecología y práctica médica. En una vista del estudiante. Ellen, una estudiante de medicina, describe su curso o su grado. Yo apenas estoy terminando mi primer año de medicina. Lo que me gusta de este curso es que tú estás involucrada, envuelta con pacientes desde el inicio. Incluso en nuestro primer año nosotros pasamos tiempo en el hospital. La mayor parte del curso es aprendizaje basado en problemas. Nosotros tenemos 2 sesiones de 2 horas a la semana donde trabajamos en grupo de 8 o 10 resolviendo problemas clínicos. Nosotros decidimos juntos cómo tratar el problema, buscamos en libros y en fuentes en línea y tomamos apuntes y discutimos el caso juntos. Es una excelente manera de aprender y acercarse a otros estudiantes y conocer o acercarse a otros estudiantes. En el pasado, los estudiantes de medicina tenían lecturas, clases con la clase completa tomando apuntes de diapositivas o imágenes desde las 9 a las 5, pero ahora es mayormente trabajo en grupo, aunque nosotros también tenemos esas lecturas y seminarios donde nosotros trabajamos en pequeños grupos con un tutor. A mí me gusta todo de ello, de este curso, incluso la disección. Nosotros cortamos cadáveres desde el segundo mes del curso. Ok. Okay, the exercise 11.1, match the activities to the stages of medical education in the UK given hypothesis. Number one, dissecting cadavers, undergraduate, keeping a log of surgical procedures observed and performed, postgraduate, working for 4 months in accident and emergency to experience this specialty, foundation program, taking a 4-week attachment in obstetrics and gynecology, undergraduate, taking an online course on recent developments in cardiovascular disease, continuing professional development. Complete the sentences. Number one, just before their final year, students have the chance to take an elective in a hospital of their choice anywhere in the world. Two, problem-based learning contrasts with an approach where each subject is taught separately. Number three, these days lectures are often interactive with regular opportunities for the students to ask questions. In clinical skills, students learn how to treat and manage patients. Number five, student-selected models can be a topic from outside medicine, such as a foreign language. This section of cadavers is an important part of the anatomy component. The medical school at the University of Edinburgh is one of the oldest in the UK. She's a consultant at the Royal, one of the leading pediatric heart specialists in the country. The Royal College of Surgeons in Edinburgh dates from 1505 or 1505. And number 10, we have a seminar each week where we discuss topics in a small group with our lecturer. And 11.3, match each of these activities to one of the components of the undergraduate course. Number one, Julie spends 6 weeks working in a small hospital in the Himalayas. That's an overseas elective. A group of students discuss together the possible reasons for abdominal pain after meals in an obese 44-year-old male. That's problem-based learning or PBL. A small group of students trace the pulmonary artery in a cadaver. That's dissection. Otto spends a month working in the pediatric ward of the local hospital, clinical attachment, and learns how to take blood from an elderly patient, clinical skills. And Juma chooses to study in travel medicine in his 4th year, student selected model. Over to you, describe the main components of your undergraduate course. Okay, we have to study medicine from 5 or 7 years, then 1 year and a half. Well, that means 1 year and a half of medical school, then 4 semesters or 2 years of basic science signatures, then the pre-internship, internship, and so on. Okay, penultimate chapter. Number 12, medical education 2. The foundation program. The foundation program is a 2-year training program which forms the bridge between university-level study at medical school and specialist or general practice training. It consists of a series of placements, each lasting 4 months, which allow the junior doctor, known as a trainee, to sample different specialties, for example, pediatrics. A year 1 trainee corresponds to pre-registration house officer, PRHO, posts, and a year 2 trainee to senior house officer, posts. Each trainee has an educational supervisor who ensures that more senior doctors deliver training in different ways, including clinical and educational supervision. To progress, trainees have to demonstrate a range of clinical competencies which are assessed through observation in their workplace. B, people in medical education, a tutor, an academic, or in some cases, as a postgraduate student who leads tutorials. A demonstrator. In anatomy teaching, someone who demonstrates how to dissect. Demonstrators are often postgraduate students paying their way through medical school. Lecturer, senior lecturer, an academic with teaching and research responsibilities who contributes to the teaching of a particular discipline. Professor is a senior academic with teaching and research responsibilities for a particular discipline, usually a leading figure in their discipline. College tutor, a consultant responsible for delivering a college training program. A clinical trainer is a consultant assigned to a trainee who provides training during periods of direct clinical care. And an educational supervisor is a consultant who supervises a trainee's period of training. Medical qualifications. Bachelor of Medical Sciences, a degree often taken after 3 years of medical studies by students who may wish to follow a career in medical research. Bachelor of Medicine, Bachelor of Surgery. Bachelor degrees are undergraduate degrees. This is the first degree for UK doctors. Dr. MD or DM is Doctor of Medicine. The RCOG is a diploma of the Royal College of Obstetrics and Gynecology. MRCP or MRCS is member of the Royal College of Physicians or member of the Royal College of Surgeons. Doctors become members by successfully completing the assessment procedures in their college. And the last one, Fellow of the Royal College of Surgeons of England. Other colleges are indicated by the letters which follow. For example, Edinburgh, Glasgow, or Ireland. How doctors become a fellow depends on their college. For the FRCS, further examinations must be passed. For other colleges, it is by nomination or work assessments. Ok, Educación Médica 2. El programa de entrenamiento es un programa de entrenamiento de 2 años que forma el puente entre el nivel universitario de estudio de la Escuela de Medicina y el especialista o practicante general. Consiste en una serie de puestos, cada uno durando 4 meses, que le permiten al doctor recién graduado, conocido como trainee o aprendiz, a realizar o verse en diferentes especialidades, por ejemplo, pediatría. El aprendiz o trainee de 1 año corresponde al preregistrado house officer, y el trainee o aprendiz del 2.º año, practicante del 2.º año, es conocido como senior house officer. Cada aprendiz, practicante, tiene un supervisor educacional que se asegura o da que muchos doctores lleven a cabo especialidades o entrenamientos en diferentes áreas, incluyendo clínica, supervisión clínica y educacional. Para progresar, los practicantes tienen que demostrar una serie de competencias clínicas que son evaluadas por observación en su lugar de trabajo. B. Personas en la educación médica. El tutor es un académico, en algunos casos un estudiante postgrado que ya se ha graduado, que lleva a cabo o que da tutorías. Un demostrador en, en la enseñanza de anatomía es alguien que enseña cómo disecar, diset. En esos demostradores son usualmente estudiantes graduados pagando su camino por la escuela de medicina. Un senior, un lecturer es un académico con responsabilidades de enseñanza y de investigación que contribuye a la enseñanza de una disciplina en particular. Un profesor es un académico que con responsabilidades de aprendizaje e investigación de una disciplina en particular. Usualmente son una figura de liderazgo en su disciplina. Un tutor del colegio, pero no colegio médico en sí, es un especialista responsable de dar el programa de entrenamiento en un centro especializado para dar para las especialidades. Un entrenador clínico es un especialista asignado a un practicante que le provee entrenamiento durante el periodo directo con el cuidado clínico. Y un supervisor educacional es un especialista que supervisa el practicante durante su periodo de entrenamiento. Y, y las cualidades médicas son licenciatura, se podría decir, en ciencias médicas, es un título usualmente dado a, después de 3 años de estudios médicos a estudiantes que desean seguir una carrera en investigación médica. Licenciatura en medicina y licenciatura en cirugía. Estas licenciaturas o títulos son títulos que van antes de graduarse. Este es el primer título para los doctores de Reino Unido. MD o DM es doctor en medicina, el otro es diploma del Colegio Real de Obstetricia y Ginecología, el siguiente es miembro del Colegio Real de Doctores y miembros del Colegio Real de Cirujanos. Los doctores se mueven miembros satisfactoriamente, completando las evaluaciones, los procedimientos en su colegio médico. Los procedimientos evaluados en sus colegios médicos. Y el último es el más graduado, el especialista o el director del Colegio Real de Cirujanos de Inglaterra. En otros colegios médicos están indicados por las letras que lo siguen. Por ejemplo, Edinburgh, Glasgow o Ireland. Irlanda. Como los doctores se convierten en esto, depende de su colegio médico. Por ejemplo, en el primero, exámenes deben ser pasados y en otros puede ser por nominación o por evaluación de trabajo. Okay, the exercise 12.1. Complete the phrases with verb from the box. Two phrases can be completed in two different ways. Okay, demonstrate a competence or how to do something. Supervise a trainee by ensuring she successfully completes her training. Number 3, provide a course or a training program as a teacher. 4, take a course or a training program as a student. 5, assess or demonstrate progress or competence. 12.2 is match the two parts of the sentences. An foundation year 1 doctor is a doctor in the first year of the foundation program. A demonstrator is an anatomy teacher and who teaches dissection. A clinical trainer is a consultant who provides training during periods of direct clinical care. And a supervisor is a consultant responsible for the training program of a trainee. A medical school is part of a university responsible for medical education. A placement is a period spent as a trainee in a hospital or in general practice. A college is a body of specialties responsible for deriving and assessing training in their specialty. And a fellow is a specialist who has reached the highest level in their specialty. 12.3, write in full the qualifications of the doctors and surgeons. Mr. A.H. young husband is a Bachelor of Medicine, Bachelor of Surgery, Fellow of the Royal College of Surgeons and of England and of Ireland. And Dr. C. Doyle is a Bachelor of Medical Sciences, is Doctor of Medicine, member of the Royal College of Physicians. And Miss E. Inglis has a Bachelor of Medicine, Bachelor of Surgery, and is Fellow of the Royal College of Surgeons. And Dr. E. Merriweather has a Bachelor of Medicine, is a Doctor of Medicine, Fellow of the Royal College of Physicians. And the last chapter, the number 13, the overseas doctor. 8, types of registration. To manage and treat patients in the UK, all doctors must register with the General Medical Council, GMC. These are several types of registration. There are provisional registration is for doctors who have just qualified from medical school in the UK or from certain European Economic Area member states. Full registration is for doctors who have completed their year's clinical training. Limited registration is for international medical graduates who have not completed the equivalent of a year's clinical training in the UK. And the specialist registration is for doctors who have completed a specialist medical training and have a certificate of completion of training, CCT. The GP register is a register of all those eligible to work in general practice in the National Health Service. Ok. Capítulo 13. Doctores del extranjero, del exterior. Tipos de registro. Para manejar y tratar pacientes en el Reino Unido, todos los doctores deben estar registrados en el Consejo General Médico. Hay algunos tipos de registro como Registro provisional. Es para doctores que se han calificado de la Escuela de Medicina en el Reino Unido o de alguna área europea que forme parte de ellos. En registro completo es para doctores que han completado en los años de entrenamiento clínico. Registro limitado es para médicos graduados internacionales que no han completado los años de entrenamiento clínico equivalentes a los años en el Reino Unido, y el registro especial para especialistas es para doctores que han completado entrenamiento médico especial y tienen una finalización, tienen un certificado de finalización de la formación. Ok, V, FLAP. Before they can obtain full registration, some categories of overseas doctors are required to take the Professional and Linguistic Assessment Board, PLAB test. PLAB is designed to ensure those who pass can practice safely at the level of a senior house officer in a first appointment in a UK hospital. Part 1 consists of a written test of knowledge, skills, and attitudes. Part 2 is an objective, structured clinical examination. It consists of 16 5-minute clinical scenarios, known as stations, to assess professional skills. And C is FLAP stations and advice. OCs assess these skills. Clinical examination, your ability to carry out a physical examination of a simulated patient. An actor trained to play this role will be assessed. Uncomfortable or intimate examinations will be carried out using a mannequin and anatomical model. Practical skills. You will be assessed on practical skills such as suturing and giving intravenous injections. Communication skills. Your ability to interact with a simulated patient, or in some cases, the examiner, will be assessed. Skills tested may include breaking bad news and giving advice on lifestyle. History taking is your ability to take an accurate history and make a reasoned diagnosis will be assessed. Advice on the stations from a successful candidate. Read the instructions outside each station carefully. You have 1 minute for this. Don't forget the ABC protocol, that means airways, breathing, and circulation in every emergency station. And keep in mind safety precautions, like throwing the sharps in the sharps bin. And check the patient understands what is happening. Then ask them about any concerns they may have. Don't just give a lecture. Listen carefully to what the actor says. Entonces, B, FLAP, antes de que ellos puedan obtener completo registro, algunas categorías para doctores del extranjero son requeridas para hacer el examen o la evaluación profesional y lingüística. Este examen es diseñado para fortalecer a aquellos que pasan para que puedan practicar seguramente como el nivel de un senior house officer en una primera cita o entrevista en un hospital de Reino Unido. La primera parte consiste de un examen de conocimiento escrito en habilidades y actitudes. Y la parte 2 es un examen clínico estructurado y objetivo. Consiste en en 16, 5 minutos de escenarios clínicos conocidos como estaciones para evaluar habilidades profesionales. La C, en PLAB, en consejos y estaciones. El examen de clínico y estructurado y objetivo evalúa las siguientes habilidades. Examen clínico, examinación clínica. Tu habilidad de llevar a cabo un examen clínico de un paciente simulado. Un actor es entrenado para llevar a cabo este rol. Eso será entrenado. En exámenes incómodos serán llevados a cabo usando un maniquí o un modelo anatómico. Evaluaciones prácticas. Serás evaluado en evaluaciones prácticas como suturar y dar inyecciones intravenosas. En habilidades comunicativas. Tu habilidad de interactuar con un paciente simulado o en algunos casos el examinador será evaluado. En habilidades que serán evaluadas pueden incluir en cómodas malas noticias y cómodas consejos en estilo de vida. Y tomar la historia clínica es tu habilidad de tomar una historia clínica acertada y hacer un diagnóstico razonable, ser evaluado. Harán consejos en las estaciones de un candidato exitoso. Lee las instrucciones afuera de cada estación cuidadosamente. Tú tienes 1 minuto para esto. No te olvides del protocolo ABC, que significa vías aéreas, respiración y circulación en cada estación de emergencia. Toma en cuenta precauciones de seguridad como botar los elementos y dispositivos punzantes en el zafacón de estos objetos y chequea lo que le está pasando al paciente. Luego pregunta sobre alguna queja que ellos podrían tener. No solo hables, no solo des un diagnóstico o algo, también escucha cuidadosamente lo que el actor dice. En the exercise. Okay, 13.1. What kind of registration might these doctors obtain? A newly qualified Spanish doctor, provisional registration. A newly qualified Nigerian doctor, limited registration. A doctor who has successfully completed the first foundation year, full registration. And a senior house officer who has successfully completed the foundation program and gained a certificate of completion of training after several specialist register posts, specialist registration. 13.2, write the abbreviations in words. Number 1, any doctor who wants to work in the UK must register with the General Medical Council. Some overseas doctors must pass the Professional and Linguistic Assessments Board test before they can register. Part 2 of the test consists of an objective, structured clinical examination. And number 4, in any emergency, remember the ABC protocol: airways, breathing, and circulation. And before you can obtain a specialist registration, you must have a certificate of completion of training. 13.3, complete the text. My name's Musa and I come from Yemen. I came to the UK about 2 years ago after graduating. Because Yemen is outside the EEA, I could only obtain limited registration with the General Medical Council at first. It was very difficult for me to obtain a place on a foundation program. Although I speak good English, I had to take the FLAP test to show that I could work safely in the UK. If I had to give some advice to other candidates, it would be that at concealing stations, you shouldn't simply memorize a set of phrases. It's better to really think about what you are saying to the actor and get the intonation right. After completing my year's clinical training, I was able to obtain full registration, but I found it difficult to get a senior house officer post in my chosen specialty. Pediatrics. Pediatrics, as hospitals now have to demonstrate there isn't a suitable candidate from the EEA. Once I've completed my second foundation year, I should obtain a CCT, which will allow me to proceed to a specialist registration with the General Medical Council, an important step on the road to becoming a pediatric consultant. That was everything. Thank you so much. Nos vemos en una próxima.